Welcome to the critical importance of cultivating psychologically healthy and safe work environments. Thank you for joining us today. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. This webinar is part of our Harnessing Talent Alliance series. Harnessing Talent Alliance for Recruiting and Retaining Canadians with Disabilities is a 3-year project funded by Employment and Social Development Canada. We would like to thank our 9 founding partner organizations as well as our academic team. If you would like to learn more, please visit our website harnessingtalentalliance.ca and follow us through our Harnessing Talent social media channels. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. Today, we're extremely happy to welcome Dr. Joti Samra. Dr. Joti Samra is a national thought leader on issues relating to psychological health, wellness, and resilience, and has been heavily involved in research, policy, and consulting work around the National Standard of Canada for psychological health and safety in the workplace since inception. Dr. Samra is the lead research scientist who developed the 13-factor frame in the standard, and she's a founding and ongoing member of the CSA technical committee that developed the standard. This standard is the first of its kind in the world and is shaping policy development for workplace psychological health and safety at the international level, ISO level. Dr. Samra is the clinic founder of Dr. Joti Samra, R-Psych and Associates, with a team of clinical counselors offering in-office and online virtual therapy services throughout BC. She is also the CEO and founder of MyWorkplaceHealth, a full-suite national workplace consulting firm. Dr. Samra has a team of associates, industry experts, and consultants across Canada who have extensive expertise in all things related to psychological health and safety strategy and implementation, leadership management training, and enhancement of employee resiliency. So without further ado, I'll hand it over to you, Dr. Samra.
Thank you so much, Yusra, for that introduction, and to the Institute for having me. And good morning, everybody, from lovely Vancouver. It's my real pleasure to be here speaking about a topic that is very near and dear to my heart and something that I'm very passionate about and have really immersed my career. I've been a practicing psychologist for almost 20 years and have been heavily immersed in work around psychological health, wellness, resilience, and in particular, creating psychologically healthy and safe work environments for the bulk of that time. And so very happy to be speaking about the standard and the importance that every single organization, from the small mom and pop all the way up to, you know, the big kind of multinational, in terms of starting to invest attention and energy and take actionable steps to create psychologically healthy and safe work environments. And so I have a few aims this morning. I'd like to start by talking about just the critical importance of psychological health, wellness, resilience, what we're meaning when we talk about psychological health. I'd like to share some statistics with you and just really invite everybody to think about the importance of paying a little more attention to our psychological health, both broadly and generally in life, because I believe as a society, you know, we don't do nearly enough and certainly don't put enough attention on attending to our emotional wellness in the same way that we may about our physical wellness. But certainly when we think about our work environments, and I hope to kind of convince you by the end of this morning on the importance that we all have within work environments to both take individual responsibility as employees or coworkers to be able to foster and cultivate a psychologically healthy, safe work environment. And then certainly for any of us that are in leadership or decision-making roles, the importance that we have of starting to better understand what the standard is, what psychological health and safety means, and start to embed that within our work environments. I'm then going to give you a very bird's eye view of the standard and the 13-factor frame that we have in this standard. I could spend easily a day and certainly even up to a week speaking about kind of the standard and all the factors. So today is just kind of very bird's eye overview on what we're talking about when we talk about the standard, and to give you a flavor of the areas that we're thinking about needing to address when we think about creating healthy and safe work environments. And then finally, I'd like to end with some actionable kind of next steps that everybody can take. It's a work environment talk, and so it's hard to do a work environment talk without thinking about Dilbert. And he says here, tomorrow is the mandatory meeting on employee health and well-being. The meeting starts at 6 a.m., so it will interfere with your sleep and not your work. And he says, doesn't that send a message that work is more important than health? I hope so. That's the theme of the meeting. No, it's not the theme of the meeting, and it may be 6 a.m. for some folks somewhere. Not here in Vancouver, but certainly I want to commend all of you for taking time out of busy schedules and days to invest time in learning a bit more about a topic that impacts every single one of us. I invite everybody to just, reflect for a moment on psychological health overall. And we're here talking about a standard, which sounds like, a big kind of technical thing, which it is. The standard is a technical document, it's a policy document. When we're thinking about psychological health and safety, we are talking about things like policies and procedures and systems. But much more broadly, what we're ultimately talking about is relationships within our work environments, and the way that we all show up and the way that we all are going to struggle at times with our psychological health. And, it's very easy for us to get caught in the rhetoric of all the things that are wrong with our work environments, right? And I'm going to talk about some of the stats. Certainly work looks very different in modern day than it used to, 10 or 20, certainly 30 or 40 years ago. And certainly if we go broader than that, there's a lot of things about our work environments that contribute to, what I believe is kind of collective stress that we're experiencing. And a lot of the numbers will check out on that. But it's important to also, keep in mind that there are very good things about our work environments. And if we go back to the beginning of time, and we look at every culture and every community, we know that work in some shape or form is a very critical part of just living a happy and long, physically healthy life, but living also a meaningful life. And, the reality is there's no button that we can press that leaves our personal stuff at the door when we show up in our work environments. And so, all of us are going to have times, if we live long enough, that we're going to have periods where we're struggling, where maybe life isn't going ideal. And through that, I think in our work environments, because of course, we're there to do a job and get remunerated to deliver a service, is that what we sometimes do is get very focused on tasks and things and outcomes and kind of forget that overall what we're talking about when we talk about psychological health and safety is individuals. And, we have far more commonalities as human beings in terms of our needs for meaning and purpose and structure and social relationships. And that's, an important thing for us to keep in mind, because the other side of this is the reality is some of these challenges when they come to creating psychologically healthy and safe work environments are complex, and they're not as easy as dealing with, say, a broken leg might feel to be. And so there's layers and complexities, but ultimately at the core, we're talking about common shared experiences. I'd like to share this definition of health from the World Health Organization. So the World Health Organization, of course, is our leading international authority on health. And they define health as being a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And so I'll read that again. So a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And there's a few things that I'd like to highlight about this definition. Number one is all too often in our language, certainly in our healthcare systems, what we do is we separate out physical health from mental health. And we talk about these two things as if they're different. But every drop of clinical and research and anecdotal data will tell us that we simply cannot separate out our physical and our emotional health. And if we look at things like comorbidity, so how often, physical health issues are associated with mental health issues, we know those comorbidity rates are very high, 70 to 80% or higher in some cases. We know that it's an artificial belief that somehow we can separate out thinking about our physical status, which includes all the way from, illnesses or even injuries, that somehow we can separate that out from how we function emotionally. They overlap. And when we're thinking about good health, high quality health, we know that it's a combination of a number of factors. So overall health encompasses how we feel physically. It encompasses kind of mentally, emotionally, spiritually, how we're feeling. And health is not just the absence of disease. So it's not just having something wrong with you. It's also, there's a promotion and prevention component. So what we know is we can enhance our overall health physically and psychologically. In the same way, many of us may engage, probably not regularly enough, but engage in things like drinking enough water or eating your fruits and vegetables or getting a little bit mobile, most days, at least for short windows of time. Those are good things that we can do to enhance our physical health. And similarly, we know there's a whole host of things that the science will tell us we can do to enhance our psychological health. And while in our work environments, unless you're a psychologist practice and treating, patients or clients, our aim and the expectation is not that we're treating psychological health, but what we're doing is we're guiding and supporting and we're connecting in ways that facilitate and allow individuals that are struggling to be able to speak openly about those issues, to get support when they need. And certainly our work environments play a very critical role in terms of providing education and information on a topic that we still do a pretty poor job of as a society, thinking about, talking about, or addressing. This definition, I don't have the year up on this slide, but what I would like to note is it's a 1948 definition. And so the World Health Organization has understood that we can't separate out physical and emotional health for decades, almost a century. And so again, I invite everybody to think about language that we're using. I believe so much that the language that we use impacts how we think about the world, how we perceive the world. And so things like stress leave or mental health leave, there's no such thing. We have health leave or medical leave. Some of the time it's for a predominant physical health issue. Some of the time it's for a predominant psychological health issue. And almost always the two are intertwined. Now, when we think about psychological health symptoms, we know that it's not a dichotomous kind of way that we should think about mental health. So it's not that we either have a mental health illness or disorder or don't. We know that psychological health symptoms exist on a continuum. And so every single day, all of us have a state of physical health. And every single one of us right now could do a little mental check and give ourselves a rating. So 0 to 100, we could give ourselves a self-rating and say, how's our physical health today? All of us could think about times that physical health rating has been higher, and all of us probably can think about times when that physical health rating has been lower. Now, I invite everybody to kind of think about what those factors are and what things enhance physical health and physical health and make it better and make it worse. But similar to our physical health, every single one of us right now could give ourselves a rating, 0 to 100, of how our psychological health is. And so I'll just pause for a few seconds there and just think 0 to 100, with 100 being absolutely, off the charts amazing. And 0, I guess, being dead. Where would you put your psychological health today? Okay, so give yourself a number, and then also think about times when that number has been higher. think about times when that number has been lower, and just kind of skim through your mind and think about some of the factors that contribute. And if you went through this exercise and kind of wrote down things for both physical health and psychological health, and if we were to share that, what we would all see is there's a whole host of commonalities that affect both in the same way. So things like our sleep, things like how well our relationships are going, whether there's anything kind of big and bad happening in our personal life, whether we've been eating healthy, whether we've been sleeping okay. These are all factors that affect both physical health and emotional health. And our symptoms exist on a continuum. And so every single one of us, most days, is probably going to have some little ups and downs in terms of unpleasant emotional states that we experience. So whether it's that alarm going off, after you've had a crummy night of sleep, or spilling coffee on your shirt before you get out the door, or your, kid driving you bonkers as you're trying to get organized for the day. We have little things that come and go through the course of the day, and that's a very normal part of just being human. All of us are going to have times when we've been under significant distress. Maybe it's hours, maybe it's days, maybe it's even weeks. And usually kind of acute distress is related to acute things that are happening in our life. And when that thing gets better or resolved or goes away or solved, our kind of psychological health goes back to what its baseline was. Every single one of us is going to have had times that we've been under chronic stress. So where our kind of body and emotions are telling the story, and where it might be weeks, months, where we're under ongoing, unrelenting demands that start to affect how we're functioning and affect how well we're functioning across a few indices: our social relationships, our emotions and quality of life, and then our work function. And so this is when we're not kind of at our 70 or 80 or 90%, but might be operating times more like 40 or 50 or 60%. And every single one of us is going to have had psychological health symptoms that we experience. So if we were to get our kind of psychiatric Bible, the Diagnostic and Statistical Manual of Mental Disorders, and we went through and listed all the symptoms that exist, what we would all know is that we've all experienced lots of symptoms over time. And then a certain percentage of us will meet criteria for a mental health diagnosis, so an illness or a disorder. So we're going to put up our first poll question here. And so we'll open this up to the audience. I'd like you to think about, per year, what percentage of working Canadians experience a psychological health condition? Okay, so let's take a look. We have 0% said 5, 2% said 10, and 52% said 20%, which is the right answer, and then 50% or more said 46. So the answer is, let me flip back to my slides here. If we look at the per annum prevalence, we know that 1 out of 5 Canadians every single year will experience a psychological health issue or illness. 1 out of 5, so 20% every single year. And if we look at absolute numbers, that's 6.7 million a year. And if we compare this to some other very commonly understood and accepted and talked about health conditions, it's only, and I say only just a little bit tongue in cheek there, it's only 2.2 million for type 2 diabetes, and only 1.4 million for heart disease. So we see that the numbers are colossal. And we know a whole bunch of indices now that will tell us that psychological health issues account for the largest amount of disease burden and certainly cost. And so, the World Health Organization in 2017 identified depression, which is really a proxy term for mental health issues more broadly, as being the leading cause of worldwide disability. Okay, so the leading cause of worldwide disability. And I, for many, many years, used to say, the World Health Organization estimates that by 2020, depression will be the leading cause of worldwide disability. All things related to cardiovascular health used to be #1. And yeah, we met that number as a world 3 years in advance. And so it's very important to keep that data in mind. I mean, this is international data. So when we're thinking about psychological health issues, often, people will think or ask, is this just a Canadian issue, a North American issue, a first world problem, a developed problem? And the answer there is we know that psychological health across the board has substantive impacts on our overall level of functioning socially and occupationally, and in terms of our quality of life. If I just share some Canadian specific data, we know that on paper, if we are looking at claims, and so these are pretty robust findings. So whether we're thinking about workers' compensation boards and psychological injury, whether we're thinking about short-term or long-term disability data, that we know on paper about 30% of claims are attributable to a psychological health issue or injury, but we know that that accounts for about 70% of the costs. So about 1/3 of things on paper are accounting for about 2/3 of the cost. And again, very robust findings. And what we know, and I'm a research scientist at heart, and the numbers just don't lie, is that our psychological health issues are the biggest health issue that all of us as a society are dealing with, and certainly us in work environments are dealing with. I'd like to now shift and start to talk about work. And, as I already kind of mentioned, that when we come into our work environments, we don't leave aside or at the door all the other things that are affecting how we're doing and functioning and feeling psychologically and emotionally. And I love this quote from Sigmund Freud, who mostly said a whole bunch of things that I don't agree with, but this quote, love and work are the cornerstones of our humanness. Okay, love and work are the cornerstones of our humanness. And if we think about love in all its shapes and forms, so romantic love, love for family, love for a hobby, love for a pet, that love, passion, joy, and all the things that brings, which is often connection and purpose, that's a very critical part of being human. Right. And if we think about work, again, back to the beginning of time, and every culture and community and society engaging in our community and our extended community in a way that's meaningful, contributing in some useful, meaningful, important way is a critical part of being human. And there are so many things about work that are good for our mental health. And again, very easy to get into that rhetoric of all the things that are bad about work and how it can impact us. But we know there's so many things naturally that work offers that are really good for us. And so if we think about, if someone came into my patient practice and was dealing with one of the most common mental health issues, with anxiety disorders at the top and depression a close second, we know that there's a whole bunch of things from the science that are going to be helpful. And those things include things that work naturally offers. So structure, right? Having a reason to have the alarm set and go off in the morning and kind of make us get up and hopefully in the shower and pull ourselves together a little bit and get out of the house. That's a very good thing. And what we know when we think about when we're struggling psychologically is we withdraw and we isolate and we don't want to connect. And so going through the motions, we know the science will tell us, fake it till you make it works. And so if we can go through the motions of things that we do when we're feeling well and do those things when we're feeling unwell, that has a very important, impactful, positive effect on our psychological health. So there's structure, there's routine. And so we know anybody who's a parent will know the importance of structure and routine for kids, and really as adults, we're no different. So having predictability and structure and routine, even for those of us that think we like routine less than others, is important. It affects things like our circadian rhythms and our sleep patterns, and those have effects on things like our appetite and our energy and our attention and our concentration. We know that social connections are very critical, and the vast majority of us spend more time with our extended work families and colleagues than we do sometimes with our real biological or chosen families. And so our social relationships are really critical. And when we're in work environments where we have healthy and civil and respectful relationships, not perfect relationships, but civil, kind, respectful relationships where we can give people the benefit of the doubt, where we can appreciate that people are going to have things that impact them, when we can feel supported in those work environments, it's very good for our mental health. We know having a reason to get up every single day to do something, and hopefully most days, most of us are reasonably interested in or engaged in what we do. Again, not always. The index here is not perfection, so every single one of us, myself included, has a whole host of things I have to do that aren't necessarily on the list of what I'd love to do every single day in my life, but they're a critical part of kind of a means to another end. And so, you know, if we can feel like we're engaged in what we do, if we can feel that our skills are challenged when we're learning and growing our professional skills, our personal skills, all of these things are very, very, very good for our psychological health. Now, what we also know is there's a whole host of challenges that come along with, you know, work and our work environments and work structure, and we have a bit of a wild and wacky world that we live in. And so we think about, you know, all kinds of things. I mean, let's start with devices and technology. You know, wonderful in lots of ways. It can make us more efficient and connected. Even, I mean, right now is a perfect example of being connected with people broadly, is we can connect, and there's some really great things about that. But what's also happening is, you know, gone are kind of those firm lines between personal life and work. And, you know, once upon a time when stores used to be closed on Sundays and we had a set time that we were kind of done work, well, that's not true anymore for most of us. And you know, that has an impact on our psychological health. We know financial stress, and, you know, I'm in beautiful but very expensive Vancouver, and we think about, you know, at least a third of Canadians are chronically stressed about finances. We know if we look at things that are happening in the political climate, climate change, and we're looking at our current health crisis with coronavirus. I mean, all these things in our society really impact our psychological health. And if we look at households where 2 adults and breadwinners are living, that now both of those are having to usually work close to full-time, longer hours, and this is having a real impact on family configurations and other demands. And so we know about 30% of people are in what's called the sandwich generation. So not only do they have childcare responsibilities, but there's elder care responsibilities. And so all of these are factors that, you know, one, are important for us to keep in mind in terms of the way that they impact our individual psychological health, but are also critical for work environments to consider, because if we're thinking about evolving work environments and innovative work environments and work environments that are really, you know, kind of starting to do good things when it comes to psychological health, things like flexibility and adaptability are critical. And so there is a change that's required, I think, in many of our environments, just given the nature of work that we're doing. So if we shift to thinking about employers' responsibility, so what is it that work environments have to do? Well, we know that there's 2 areas that we want to attend to in our work environments. So one is providing supports to the individual employee. And so, you know, that may be all the way from making sure we've got good hiring policies that don't discriminate because someone has a history of mental health issues, all the way to kind of teaching our leaders and managers and supervisors to have the language and skills that they need to approach someone who might be distressed in the work environment, all the way to, you know, allowing people an absence from work without any punitive impact on their status within the work environment for health reasons. And so many organizations, especially the larger organizations that have more kind of solidified departments and divisions and benefits and human resources, there's a large infrastructure. A lot of those organizations are doing not a bad job when it comes to supporting individual employees and recognizing that there's a whole host of very well established policies, procedures, legislation, guidelines that prevent us, from discriminating in our hiring practices, from accommodating mental health issues, etc. Now, what the standard does, and I'm going to shift to starting to talk about that now, is it says, okay, you work environment need to attend to individual employees, so kind of the way that all of the legislation, etc., and best practices tell us we should. And in addition to that, you need to start to pay attention to overall organizational functioning. And so factors within the work environment that may or may not at any given point in time be tied to an individual employee struggling, but factors which we know from the law or the research tell us that attending to these factors will enhance our overall psychological health. And I'm going to get into talking about and giving you an overview of those 13 factors that we have. So another poll question, I'd like to poll your familiarity with the National Standard of Canada for Psychological Health and Safety in the Workplace. A big mouthful, I know. So is it not at all? You've never heard about it? Not very. Maybe you've heard about it, but you don't know very much about it. Somewhat, maybe you read the standard or skimmed it, or very, that you're kind of been immersed, have received training, or your work environment has implemented it. Okay, wonderful. So we've got about 20% that are quite familiar with this standard, and then about 40% that haven't heard of it or just know a tiny bit about it, and about 40 that are kind of moderately familiar. So thank you. Okay, so one is for I think it's 82% of you that are not that familiar with the standard. I encourage you to go download it. And so on MyWorkplaceHealth.com, I've got a whole breadth of free resources and links to critical reports, including links right to the standard where you can go download it. It's free, so there's no barrier to anybody other than the 3 minutes it's going to take you to go to this site and click on and enter your information, but I invite everybody to go and get a copy of the standard. It is a technical document, and it's a long technical document, but at least skim it. And so gain some familiarity, understand what the work environment, what the requirements are of the standard. And now the definition of a psychologically healthy and safe work environment is one that promotes employee psychological well-being and allows no harm to employee mental health in negligent, reckless, or intentional ways. So what the standard does is it establishes the critical importance that work environments have to do two things. So one, promote, so create a work environment that is healthy and safe. So this can be all the way from education and training and development, psychoeducation, teaching people mental health issues, teaching people how to communicate, addressing kind of particular pain points within work environments, so unique challenges that a particular work environment has. So a first responder environment, for example, is going to have very unique demands versus, say, an educational institute or a hospital. And so understanding what are the unique stressors and challenges and pain points within organizations, and what can we do to help enhance the overall health and resiliency of employees within those organizations. What the standard also does is outlines the imperative that organizations have to attend to the big bad stuff. So making sure that there's no harm being done. So again, negligent, reckless, or intentional ways. This is verbatim from the standard, and where we have this language from is case law. And so all of the factors that are within the standard either have a strong basis already in usually case law or some other legislative source of law, or in the research, and many are kind of both areas. And so what we're wanting to do is be very thoughtful of making sure that we're enhancing areas of the work environment according to the psychosocial factors that the standard outlines, and also stepping in, troubleshooting, problem solving areas of particular challenge within a work environment. Now, within the standard, there's a particular emphasis on what's called psychologically safe leadership. So again, psychological health and safety is not just about policy or procedure. It's about taking a construct and embedding that in every stage of the employment life cycle. So all the way from our recruitment, to our hiring, to our onboarding, to our performance management, to exit, is making sure that we are engaging in civil and respectful and appropriate ways in terms of how we interact. You know, and as I've been saying for many years, people do not quit salaries. People quit people. And so when we're looking at the biggest challenges and biggest pain points within organizations, it often comes down to the way relationships are. The standard will say, okay, you work environment have a particular imperative to attend to creating an overall healthy work environment, right? You have a higher authority as a workplace. And it also says you work environment have a particular imperative to ensure anybody that's in a people leader position, right? So someone responsible for managing or leading or supervising another person, you have a particular imperative to make sure that those individuals are equipped with the skills that help them enhance workplace psychological health and safety. And so here's just a few of the relevant clauses from the standard. So the standard will outline the responsibility for organizations to set expectations and requirements for those in leadership positions to prevent psychological harm, promote psychological health and safety of workers, and address problems related to psych health and safety. And furthermore, what the standard does is it recognizes that, you know, unless you're a psychologist and running a psychologist firm, probably the vast majority of your staff aren't going to have any background on mental health or any kind of formal training. The standard is not about mental health treatment. It's not about having us become therapists. It's not about us solving mental health issues. It's having the skills to make sure that we're providing appropriate supports. And the standard recognizes that the average people leader is not going to have any exposure to anything within this domain. So the work environment has a particular responsibility to ensure that anybody within a people leader position is given with the appropriate coaching and mentorship and supports to engage in psychologically safe leadership. Now what I'd like to do is I'm going to show a short video clip, and what I'd like you to do as I'm going through this is just kind of make a little mental note of all the things that you see going wrong from a leadership end within this clip. So I'm going to have to go off to another screen and hope for no technical problems here.
Oh, good morning, Miranda. Maybe Isaac. I don't see my breakfast here. My eggs here. Where are my eggs? All of the Polaroids from the lingerie shoot. All of the brakes checked on my car. Where's that piece of paper I had in my hand yesterday morning? Girls need these surfboards or boogie boards or something. Spring break.
The twins also need flip-flops.
Pick up my shoes from Blahnik and then go get Patricia. Give me that little table that I like at the store on that. There's a reservation for dinner tonight at that place. Have you left empty notes delivered today? Yes, everywhere. Why is it not? I'm supposed to be broken.
I should have added a poll question on how many people are familiar with that video, but some of you may remember Devil Wears Prada, and although it's a kind of exaggerated portrayal of a bad leader, I think all of us can relate to that feeling of being on that receiving end of working with someone that has some of these attributes. And what I'd like to do now is I put on this next slide the 13 factors that are within the National Standard of Canada. So again, I could spend a day on each one of these factors, but I'd like to kind of go through them very kind of rapid fire. So if we just look at that small, exaggerated kind of portrayal of a bad work environment, we can whip through all of these and see how they manifest in terms of psychosocial factors. So one is psychological support. There's, we know that, you know, probably poor Miranda there isn't going to be feeling very very supported. She probably isn't going to go to her leader if she has any personal issue, for example. Let's say her mom died, and probably someone like her is going to have a lot of fear about even going to work to tell anybody anything that can give her time off or give her some accommodation or give her some concession. That's an extreme situation, but probably Miranda isn't going to feel safe to go and talk about any issues that she's having with her job, her work environment, asking questions, right? So that all falls in the psychological support realm. If we look at the overall organizational culture, right, we could tell that feeling and vibe, and we can often feel the same way we can feel a healthy family. We can often feel what a healthy work environment is like in terms of how people interact. And again, we can guess if we injected ourselves within this work environment, it's going to feel very tense and very stressful. People are probably going to feel like they're walking on eggshells. Certainly, we know that there's no clarity in leadership and expectations, right? Go get the twins. She's like, who's that? She has no idea what it is that she's doing. And we know giving clarity. People cannot do what they're supposed to do and be successful in it if there isn't clarity about how they're doing their job. And again, we'll go through, you can kind of skim through these, but civility and respect, we would say, is lacking. If we look at psychological job fit, we could all say that the leader there does not have the interpersonal or emotional skills to be a good leader, right? There seem to be some very clear things that are lacking. Probably there's no growth and development opportunities within this work environment. We're certainly not hearing any kind of recognition and reward. There's no thank you, there's no appreciation. There's no involvement in how work is done, right? She's just told what to go do. We can see that the workload is kind of excessive. We would probably say the average person might have difficulty keeping up with those demands. She doesn't look very engaged, right? That's that emotional investment that we have in our work. And again, certainly no balance, psychological protection. I mean, she has things being chucked at her physically, and we could probably imagine that this would be a boss that might communicate in inappropriate ways toward her, and that can translate into bullying and harassment. So again, very bird's eye view, but this gives you a little bit of a flavor of the kinds of factors that we need to start to attend to and do things about and provide coaching and training and supports around within a work environment. So the final poll question here, does your organization have a psychological health and safety strategy? So yes, no, or unsure. Okay, oh great. So 57% say yes, it's a bit higher than what is on average, and then 25% say no, and then 18% unsure or don't know. So if you don't know, I would encourage you to get more information from the powers that be within your organization. So that 57% is actually higher than what the usual norm is, but we know when it comes to psychological health, for most organizations, even those that might have some strategy, we know that most organizations are very more early stages with having cohesive strategies embedded across all of the stages of the employment life cycle. And for many work environments, the feeling can be like this, right? It's the you-know-what hits the fan, and kind of nobody knows what to do, and we go into crisis management kind of mode. And when we think about promoting psychological health and safety within a work environment, we want to be less reactive and more preventative and proactive in terms of ensuring that all individuals within our work environment have the skills and strategies and approaches that are required, kind of dependent on what their role is within that organization. And so what can we do? We know there's 3 main areas to think about. One is get a sense of the risks within your work environment. And so Guarding Minds at Work, which is a whole comprehensive set of assessment and action and evaluation resources that I'm the lead scientist developer of Guarding Minds at Work, that's where the 13-factor frame in the standard comes from. And all of these are no-cost resources. So, please go to MyWorkplaceHealth.com. You can go to our resources section and you can get links right that explain what Guarding Minds at Work are and kind of link you toward where to go and get more information. But a great first starting point is to get an organizational assessment of your work environment done. Get a sense, and you can do this on your own. Guarding Minds at Work has a employee survey, again, no cost, public domain, anybody within work environment can access this. It takes about 15-20 minutes for employees to complete, and you get a real nice risk report that will summarize areas of strength and areas for improvement as they pertain to all of those 13 factors, and compare those to a benchmark sample. So that's kind of step number one, is do an assessment. Number two is invest in enhancing the psychologically safe leadership skills of all your people leaders. And so last year I had released another big national initiative, which I'm very proud about, called the Psychologically Safe Leader Assessment. Also, just go to our resources page and you can link to psychologicallysafeleader.com, all free. It's a leader self-assessment that helps someone evaluate how they're faring in terms of the skills and strategies and approaches that they're utilizing. It's broken into 5 leadership domains that are all aligned with the National Standard of Canada. And then finally, implement and take action within your work environment to provide resources. So all the way from free resources, referral lists, intranet resources, lunch and learns, webinars, things to your general employee base that can help them know how to work toward enhancing their psychological health and wellness and resilience. This is something we're not taught, and the vast majority of people aren't going to come see somebody like me in an office. The vast majority of us just kind of figure out life on our own. And so our workplaces can serve very important roles in terms of providing information and access and support, which is more than just benefits, right? It's about kind of training and troubleshooting. If you're seeing someone that's struggling, to be able to give individualized support that can help them from a preventative and promotion and enhance psychological health. And in sum here, we know all of the data will tell us that it is win-win to invest in creating psychologically healthy and safe work environments. Employees are happier, healthier, there's less accidents, less injuries, they're more invested, they're more willing to invest what's called discretionary effort, going that extra mile, they're more loyal, and they're more satisfied with the work that they do. And we know that when we have these factors at play, when we have happy, engaged, loyal employees, things like customer and client ratings are higher, and the ultimate kind of bottom line for a business is enhanced. When our relationships are better, when we're supporting those relationships, when we're doing away and troubleshooting and making sure we have actions that we're taking when we're seeing bad things happening within a work environment, that really helps to contribute to overall kind of cohesiveness and trust within a work environment. And if we look at all of the numbers, so things like disability rates, absenteeism, presenteeism, turnover, that all of these things are enhanced when we are investing in creating healthy and safe work environments. I'd just like to close with this quote that I love from Simon Sinek. So if your actions inspire others to dream more, learn more, do more, and become more, you're a leader. And so I invite everybody to think about one actionable step that you can take, big or small, that you're inspired to think about doing after this webinar. And we will close there, and we've got here is a link to all of our social media platforms. So we are very social media connected, and we encourage you to sign up for our newsletter. We have lots of useful tips all around the standard, and we've got lots of blogs, whiteboard videos, YouTube videos. And so both of our sites, drjotisamra.com is our counseling practice, and then MyWorkplaceHealth is our workplace consulting company. And so on both of those, I've put a very strong value throughout all of my career in terms of providing a lot of publicly available, no-cost information. So I please encourage you to check all of that out and then connect with me on LinkedIn and other platforms. But otherwise, we'll pause there. Thank you so much, and I think we'll take some questions.
Thank you so much for this excellent webinar. And immediately we will open it up for questions. So I invite our attendees to input their questions in the question box. Our first question is, in your opinion, what are the reasons depression had become the leading cause of disability worldwide earlier than it was predicted?
Yeah, great question. So, you know, why do we think that the rates are higher? You know, I think it's two things. I mean, one is there's the awareness piece. And so collectively, I think as, you know, societies and the world more broadly is we think about and we understand mental health now and have evolved in our understanding of that. So if we step back, I mean, you know, nervous breakdown used to be the term that was used in the 50s and 60s for someone that was struggling and kind of off you got shipped to a psychiatric ward. Homosexuality used to be in the Diagnostic and Statistical Manual of Mental Disorders, right? And so we think of things that there was a lot of ignorance and lack of understanding and stigma around mental health. So one of the things that I believe is that we've just evolved and we understand, see it, assess it, talk about it differently. Factor number one. And then number two is parallel to that, our world is getting more complicated. So again, technology, evolution of things like the gig economy, remote work, the climate as in environmental climate, but political climate, all of these factors, I think, are all collective sources of stress.
Makes sense. Thank you, Dr. Samra. Second question is, can you help identify the skills that leaders should acquire in the frame of psych health and safety?
Yeah, wonderful question. So what are the skills that leaders should enhance? And actually, can I screen share here? Is there any, should be no reason I can't do this, because I'd love to just show people the psychologically safe leader assessment. So this you can link to from our site. So the psychologically safe leader assessment, this is what the site looks like. And we've got 5 domains here. And so I won't bore you with the technicalities of the research methodology here. You could read about that elsewhere. What we took is the 13 factors and distilled those into 5 that have high face validity and kind of map onto leadership skills. So the first, you know, not a surprise, is communication and collaboration. So we know we can invest in helping people develop effective communication skills and strategies, collaborative approaches that helps. Social intelligence, so that's a broad construct of helping individuals develop awareness of their own emotional states, being able to detect and recognize others' emotional states, having flexibility and adaptability and understanding kind of emotional language and emotional manifestations. Problem solving and conflict management. We know this is one of the biggest things. So just as human beings, it's hard for many of us to give negative feedback or constructive feedback, to deal with conflict. By nature, a lot of us are just naturally conflict averse. And so when we can equip our leaders with tangible skills that can help them know how to troubleshoot difficult situations, give that difficult performance management feedback, not be throwing themselves emotionally when we're doing this. That's the third skill. Security and safety, again, that's the big bad one when we think about preventing things, and this includes things all the way from giving people the confidence and the skills and at times the authority to step in if they're observing inappropriate behaviors, language, statements from other staff, and having consequences, you know, appropriate kind of disciplinary consequences when we're seeing inappropriate, disrespectful, incivil things within the work environment. And then finally, fairness and integrity, which in many ways is one of my favorites, but it's an overarching construct. So this isn't a standalone factor, it's one that's embedded across. So when we can think about having integrity in the way that we approach relationships, even difficult situations, if we can think of fairness in our decision making and our approaches, that these are the 5 psychologically safe leadership skills.
Thank you so much for this thorough answer. The next question is, do you think that the health and safety standards will be legislated like other OHS legislations?
Yeah, it's a very interesting question. So it's one that our CSA technical committee, we have lots of discussions about this and wonder what we're starting to see is some elements of the standard are getting embedded in legislation. And so of the factors, there's a number, and psychological protection would be one of those. That's inclusive of bullying, harassment, physical violence. We know that across the provinces, we're seeing, each province is slightly different stage, but we're seeing evolution in terms of legislation for certain areas. Other areas, we likely aren't going to necessarily see legislation per se, but we're going to see it get embedded in law, and that's case law. And so we know that when we look at other standards and the way that standards get embedded in law, it takes, years and really decades for it to get fully embedded in law. So it's usually when things go wrong, someone gets a lawyer, someone goes to court, and then a ruling is made. So the answer is yes on some things, and we'll see what happens on some of the other factors. So the more legally grounded ones, civility, respect, demands, psychological protection, and psychological support are heavy on a legal basis already. And so those are the ones that we're suspecting. We're already also starting to see a number of groups and big groups. So I'll use just one illustrative example is the BC Nurses Union here in British Columbia was the first union to incorporate language about the standard in their collective union. And we're starting to see other unions that are starting to do this. It's the workers' compensation boards, we kind of suspect we'll start to have to attend to some of these factors in an increasing way, but we're kind of at where health and safety was in the 1920s when we think about where psychological health and safety is. So although the standard came out 7 years ago, which is hard to believe, 7 years ago last month, it's baby stages still. So it's still a toddler in terms of the developmental history.
Perfect. Thank you, Dr. Samra.
And I've just put up here just as we're talking too. So here's resources that if folks are interested in, we've got lots of downloads and all the links to the resources that I've talked about and more. And these are all free resources. So I really invite you to go take a look.
Perfect. And we can link to those resources on our website as well for them to be accessible. So the next question is the percentage higher for unhealthy psych environment in union environments?
So is it unhealthier? I would say the data will not support yes or no on that. We know they're different. And so we know there's different challenges that may be in unionized versus non-unionized environments. If we look at some of the data on implementation of the standard, it's actually very parallel between unionized and non-unionized environments, the percents that are taking them on. We know the union can also often have a stronger voice in terms of being able to try to get the standard on the agenda or embedded. On the flip side, we know private sector often can be faster at being able to implement things. So the simple answer is no, there's no persuasive big data, but there are differences. There's no question that there are differences between the two work environments.
Thank you. Another question is, what are some initiative HR leaders can start at companies to create a healthy work environment?
Oh, great question. So HR, I love HR, and HR takes on so much of this when we think about people problems and all of the challenges that come along. The human resources folks are often serving a primary role here. And I'd say there's a number. One is draw the attention to the powers that be within your organization. So get the standard, download it. It's a great treatment for insomnia. So if anybody wants to pull that document and for some bedtime reading, a little tongue in cheek there, go through and just become familiar with it a bit. Go through it and then think about what are the different opportunities within existing structures that you have, because it can feel very overwhelming, right? And so when we think of creating a psychological health and safety management system, which is what the standard language is, doesn't happen overnight, right? It's not like a 1 day or a 1 quarter or a 1 year even initiative. The idea is that you want to start somewhere, that you want to start to pick challenge areas within your work environment and think of any opportunity, any which way that you can embed a little something somewhere. And sometimes a simple way to start is you think about staff meetings, adding an agenda item on psychological health and safety. All you do is write those 3 words on your agenda item and start a dialogue. Start to talk to employees. Every work environment, every sector, even teams and divisions within work environments have different unique needs. So understand what your employee base wants, and then look for natural opportunities where you can add a little bit more. So, for example, if you've already got a wellness committee, and they have they have some authority to I don't know, do a monthly newsletter, or yoga comes in once a month, or kind of other things in physical wellness, that could be a nice little synergy where you could say, oh, could we add some topical things on mental health?
Perfect. And another question is, the national standard was published in 2013. Are you aware if it is or will be reviewed?
Yes. So I should know this off the top of my head. I think it's 2021 that we do the next set of revisions. Yeah, it's either 21 or it might be 22. So my apologies on that. But yes, there is a regular structure that's part of kind of how the CSA standards work. And so there's our next one comes up within the next couple of years. And
perfect. And we can conclude with the last question. So if you had one message for our attendees to take with them to work tomorrow, what would it be?
Oh, that's a great question. Tell people about the standard and the fact that we have a requirement to create psychologically healthy and safe work environments, because most people don't know that.
Thank you so much, Dr. Samra, for sharing your valuable knowledge and for bringing such a positive energy to this presentation. We really appreciate your time, and again for demonstrating the critical importance of fostering psychologically safe leadership and showing that investing in mental health has clear benefits on the bottom line. One of the statistics to remember in particular is that companies with mental health programs in place for 1 year had a median annual return of investment of $1.62 for every dollar invested. So to all who are listening, thank you for your participation, and